In this video, we are going to discuss how to successfully ambulate your patient with tethers. A tether is any line or cord that is restricting your patient's movement and could possibly result in a fall or a tripping. Your patient may have a nasal cannula in place to administer oxygen. They may have an IV line hooked up to a PCA pump. Patient may be wearing SCD devices to help prevent deep vein thrombosis. They may also have a Foley catheter in place connected to a urine bag. With tethers, you want to make sure to communicate with your nurse so you know how many tethers the patient has in place. If your patient has more than 2 tethers, you may need a few extra people to help with ambulating. Other devices that may help reduce fall risks while ambulating are non-slip slippers and a gait belt. Before ambulating, you want to make sure the bed is in low and locked position. You also want to make sure that the pathway is clear and that nothing is in the way. It might be a good idea to talk to your nurse about possibly discontinuing any tethers, like a feeding tube or maybe saline lock and IV. In this situation, our nurse is going to help the patient ambulate. The patient has a saline locked IV, is wearing non-slip slippers, and has a gait belt around the waist.
Okay, we're going to ambulate today, so if you want to put your finger and hold on to it.
The patient's oxygen is hooked up to the oxygen tank as well through the nasal cannula. The patient has a Foley, so you'll want to place that below the waistline on the walker to help with ambulating. With the nurse's dominant hand, she holds on to the patient, and her non-dominant hand is going to guide the oxygen tank. In case of an emergency, you may want to have someone with a wheelchair nearby in case the patient gets lightheaded. We hope this video was helpful in educating you how to successfully ambulate a patient.